Warm greetings. It's my great pleasure to present my research work in front of this August gathering. First of all, I would like to acknowledge the organizing team of International Conference on Social Work and Sciences towards One Health and Sustainable Development for providing this great opportunity. Myself, Dr. S.GEETHANJALI, working as an assistant professor in the Department of Home Science, Mother Teresa Women's University, Kodaikanal. So my research work entitled on prevalence of nutritional deficiency among tribal adolescent girls and the impact of dietary intervention on their health status in Kodaikanal region, Tamil Nadu. So my research work exclusively focuses on underprivileged tribal adolescent community. Tribes are usually called as inhabitants of our area. They are usually lived in the isolated area. They are unique in their name, language, as well as culture. So they are officially recognized as scheduled tribes by our Indian Constitution Act. By the article number 342. So India has a place for ancient tribes. We are having the second largest tribal population next to Africa. So around 573 types of tribal population living in India, they are verbalized with different languages. So it comprises of 8.14% of total populations. So this graphical representation highlighted the population of tribal states, people living in different states. So it highlighted that the population density was higher in Madhya Pradesh and lowest density was observed in Goa. So in scheduled tribe population in Tamil Nadu, about 7.21 lakhs of tribals with 36 different tribal community living in different regions of Tamil Nadu with different languages. So the Paliyan or Paliyar are one of the primitive tribes of Tamil Nadu. That is, they are primitive in Western Ghats of Tamil Nadu, especially in Kodaikanal. Kodaikanal is otherwise called as Princess of Hills. So Paliyans are nomadic tribes. They are living in different places of Western Ghats like Yellow Hills, Varsanadi Hills, Upper Palani Hills, Lower Palani Hills, and other Western Ghats area. So come to our adolescent tribal community. Adolescents are usually denoted as a vulnerable group. As per the WHO classification, they are under the age group of 10 to 19 years. That is a transition period of childhood to adulthood. There are numerous physical, emotional, and psychological issues happen in this age. About India having highest number of adolescent population next to China. So compared to other general adolescent community, adolescent girls from tribal adolescent girls are more susceptible to getting infections, undernutrition, and other health related issues, especially anemia, underweight, and other menstrual related health issues. Undernutrition and anemia are common in general population, especially in adolescent community, in tribal community. These two issues are more prevalent among the tribal population. This is a global prevalence of anemia referred by World Health Organization. This denoted the severity of anemia is higher in India. So the Indian Council of Medical Research report also stated that compared to other states, Tamil Nadu have higher prevalence of anemia compared to our neighbor states like Kerala as well as Karnataka. So the National Family Health Survey reported the anemia prevalence was higher in non-pregnant community, the non-pregnant group otherwise known as adolescent community. So based on this vulnerability of anemia as well as undernutrition, we are framing the need and scope of the study. So nutrition is a fundamental criterion on the present as well as future health status of the adolescent, especially girls community. Adolescent is a challenging period for all the kind of crisis, like familial crisis, social crisis. In nowadays, the crisis, crime against the girl children rises day by day. Then there is a need to empower the girl children in all the aspects. Especially, they are more vulnerable to undernutrition, anemia, menstrual related health issues. It may affect their scholastic performance, it may affect their immune function, cognitive functions, scholastic performance, and other morbidity related health issues. So the present study helps to identify the prevalence of malnutrition among the tribal population and provide the dietary intervention to the adolescent tribal girls. So usually the tribal community are more vulnerable to the general adolescent population because more number of the adolescent tribal girls are first generation learners. They are very much unaware about the personal hygiene, menstrual hygiene, and healthy eating. This dietary based intervention will provide a outreach, or it provide the outlet, it provide the open medium to understand the knowledge and nutrition. It provides the communicative pathway to reach the intervention information to their family too. So it might be a key tool to improve their health status. Based on this need and scope of the study, the objective was framed to proceed the research work. So the main objective of my research work is to seek the information about the socio-demographic profile, nutritional and health status of the tribal adolescent girls, and particularly emphasis on the micronutrient deficiency and reduce the micronutrient deficiency through dietary intervention methods. So this is a research framework or research plan of my study. So the scheduled tribe adolescent girls from 12 to 19 years was selected. By the purposive sampling method, the study consists of 7 phases. The data was collected by the structured interview schedule. The schedule consists of numerous phases. In phase 1, in phase 1 we collected socio-demographic information from the respondents like age, sex, educational status, parents' occupation, income level of the family, and other socio-demographic informations were collected from the respondents. In phase 2, exclusively focus on the nutritional status of the community. In assessing the nutritional status, we have used 4 protocols like A, B, C, D. That is anthropometrical, biochemical, clinical, as well as dietary profile. So in phase 3, the assessment of general health status like menstrual profile, morbidity pattern, personal hygiene, academic performance, all these data were collected from the respondent. After assessment and data collection process, we next assessed the knowledge and nutrition by KAP schedule. This KAP means knowledge, attitude, and practice based on the nutrition, knowledge and nutrition, as well as their dietary practices. So this is a tool used to assess their knowledge level. After assessing the knowledge level, we made more modules on intervention. So more nutrition related modules like growth and development of the adolescent, physiology of reproductive system, macro and micronutrients, and other health and nutrition related issues exclusively to improve the health status of the adolescent community. There are various tools we have used like posters, pamphlets, videos, PPTs, and all the materials are used as a teaching aids to improve or enhance their intervention process. After intervention, the impact of dietary intervention was made by the post-analysis method, post-assessment technique, that is anthropometrical, biochemical, clinical, dietary. All these nutritional assessment, post-assessment was carried out. Then knowledge and nutrition also again assessed by the post-KAP schedule. So after the assessment, post-assessment, the data was assessed by SPSS software. So this is the information. This is some of the highlights or glimpses of my research work. So the study data collections were carried out in Perumal Malai, Tandikudi, Pambarpuram, Pannekkadu, Vilpatti, Manavnur, and Pumbare villages. So we collected more number of samples from Pannekkadu village. So this is data regarding the socio-demographic profile of the respondents. So 42% of the respondents from 12 to 14 years, 51% are studying in middle school level, 47% studying in high school level. They belong to extended nuclear. There from 38% are belonged from 14,500 income per month. So this socio-demographic profile denoted the most of the adolescent communities are first generation learners. Most of their parents are working as a daily wages, or worked as a bonded laborers, or they are working as a agricultural laborers. So the nutritional status, the main key determinants are undernutrition, underweight, as well as anemia. These two parameters are highly prevalent among the adolescent community. So the BMI data denoted that about 43% of the adolescent community were suffered with low weight normal. So this highlighted, so majority of the population were having underweight below the normal range of body weight. So the anemia prevalence also higher among the study population. So the severity of anemia was observed in 44%, 49% were observed by moderate level of anemia. So this two indicators these two parameters indicated they are highly prevalent among underweight as well as anemia. So the next one is menstrual profile of the respondents, because in adolescent stage, menstruation is the main parameter to indicate the reproductive health of the adolescents. It is not only a present level of health status, it is a main criterion to assess the future reproductive health status of the adolescent community. So various parameters are used to study the menstrual profile of the respondents, like the age of menarche, flow of menstruation, sanitary napkins used, and other menstrual related information was gathered from the study population. All the study results indicated they are very much unaware about menstrual hygiene and hygiene related practices. They are very much unaware about usage of sanitary napkin and frequency of napkin changes. So the next one is assessment of knowledge and nutrition. So this assessment and assessment scores denoted they secured very low scores on nutrition knowledge. So after knowledge assessment, nutritional assessment, and socio-demographic data collection, we provided dietary intervention with suitable teaching aids like growth and development of the adolescent, physiology of female reproductive system, especially nutrients and their nutrients functions, breakfast skipping practices, adulteration, food additives. All these topics were intervened to the community. So especially anemia and menstrual hygiene, both are the major major curriculum for our intervention program. So this anemia and menstrual hygiene, these two informations was intervention was carried out by pamphlet method. Videos also developed to provide to enhance the clear intervention to the adolescent community. So next one is we provided the information intervention on non-communicable diseases like hypertension, cardiovascular disease, obesity, cancer, diabetes mellitus. All these things are explained and informations are shared to the adolescent community. After intervention, the post-assessment was carried out to find out the impact of intervention. There is no change, higher change in anthropometrical status, like there is no change in height. There is a very minor change in weight as well as body mass index. After intervention, there is a little bit improvement in the hemoglobin level. So the moderate level was improved to mild level of anemia. This is a very initial level of improvement for our impact of after the impact of diet intervention. The knowledge, attitude, practice scores also raised after the intervention. This above results indicated that it is evident that socio-demographic status of the tribal community was very weak. The undernutrition, anemia, stunted growth, micronutrient deficiencies are more commonly prevalent among the study population. And so the menstrual hygiene practices as well as the various health issues are more common, and it affects their academic career also. So the knowledge, attitude, practice, and nutrition also very poor before intervention. After the intervention, after the suitable intervention with suitable audiovisual aids, the knowledge score also rises after the dietary intervention. It denoted the nutritional status was improved after the dietary intervention. So this study concluded that suitable dietary intervention is a key factor to improve the health status of the adolescent community. So it might be an initial step to bring the desirable change in the nutritional status of the adolescent community. So I thank the organizer and Mother Teresa Women's University and DST for sponsoring this research work, for funding this research work. Thank you.